So hi, everybody. I'm Dave Ryan. I'm the Chief of Hematology Oncology and the Clinical Director of the MGH Cancer Center here in Boston, Massachusetts, or Boston, as we say. And we are starting this podcast series, or Zoomcast series, for our folks in the Cancer Center and for our patients. And the inaugural Zoomcast, I've invited Kerry Reynolds. Kerry is an oncologist here at Mass General trained, came through our fellowship program, and then took an interesting career path and asked if she could run the inpatient service. And we needed someone to run the inpatient service, and she's just been an extraordinary director of that inpatient service, which usually runs about 120 or so people a day in the hospital. And then if you add the hematologists and the hematology patients and the oncology consults, there's a lot of folks in the hospital with cancer. So welcome, Kerry. And just to start, why don't you tell us a little bit about yourself?
Sure. So like you said, Kerry Reynolds. I grew up in Missouri, so kind of the heart of the Midwest. I grew up in a small town, and I was there throughout all of medical school. And then it came to thinking about a residency, so the training after medical school. And in medical school, I thought to myself, if I could do a rotation anywhere, I'd want to try Mass General Hospital. So I signed up for a rotation, and it was really in 2007 that I flew up here to do that rotation, and I was just blown away by the institution. And the whole concept was that I was just going to rotate here for a short period of time and then go straight home, because all friends and family are at home. But the reality is, since I've been here and trained here, I've stayed because of the awesome healthcare that's going on at Massachusetts General Hospital, the science, the people. So I miss home a lot in terms of Missouri, but I've been here ever since. And I did my residency here and also my fellowship before joining faculty.
So give us an idea of what's it like to run the inpatient service pre-COVID. So like, what was your day-to-day like, and what were some of your responsibilities?
Yeah, so here we admit almost 5,000 cancer patients a year. So we have multiple different floors, as you pointed out, and 10 plus teams. And the teams are multidisciplinary in that we work really closely with our oncology inpatient nurses. We have about 40 oncology inpatient nurse practitioners. We have about 70 residents that round through the service on a given year. And then we have over 100 attendings that actually participate in inpatient care. And so we think about everything, thinking about what are the new and novel therapies, such as CAR T therapy or immunotherapy. Similarly, how do we take care of the patients that may have side effects or toxicity of those types of therapies? So we've always been kind of on the cutting edge of seeing patients in the hospital that are admitted and making sure they get through their clinical course, in addition to the research aspects, as well as the training aspects to make sure we can train up the residents, fellows, and medical students that join the unit.
So what happened in March when COVID came? And how have you had to change the service and respond?
Yeah, we always have these weekly meetings where we think about how can we improve the quality, how can we improve the safety of our care, and we're always trying to make the inpatient better. And we had a lot on our agenda. But I looked back as I'm keeping a bit of a journal. I feel like I just don't want to forget this time, and I really don't want to forget some of the lessons learned. So I look back, and my first entry was March 5th. And I see that there was an email that went out about that time from another center in Boston, and it said, travel has been suspended for all physicians, scientists, researchers. And that just shocked me. I thought, this is really a once in a lifetime thing, like what we're preparing for, planning for. But even as of March 5th, I did not get kind of the entire picture. And so quickly, since that time, we started to sit down and think about how do we, one, make sure we continue to care for our cancer patients, and two, how do we help out the hospital? How do we really think about the surge of patients that we are expecting? And so since that timeline, we've really thought about how to continue our cancer care. So we still have 2 full cancer floors that are caring for those patients and still doing some bone marrow transplant, chemotherapy, and the likes of that. And then also we have been able to participate and help in opening several of the floors for the hospital to care for these patients with COVID-19. And so that's really been the day-to-day, is trying to think about how to stand up, operationalize, and train patients to our providers to care for those types of patients.
And so give me an idea, like, so are oncologists actually taking care of COVID patients? And are oncologists doing extra things that they otherwise wouldn't have done? And how about the nurses? Same thing with the nurses?
Yeah, no, that's a very good question. And at this point, the entire hospital is kind of all hands on deck. And so you're exactly right that normally we have those teams like I talked about. We have double the number of teams that we used to have on surge teams, meaning oncologists that are general medicine trained and then have an oncology fellowship. They now are caring as the physician on the team for patients with COVID-19. In addition, those care teams are multidisciplinary, just like they always have been. So we have some trainees on those care teams. We also have some nurses on those care teams, depending on what floor they are on. And we are working incredibly closely with our ID colleagues and our pulmonary and respiratory colleagues to make sure that we can care for these patients. So we're basically an extension, always connecting to the expertise, but you're exactly right. Now, in terms of oncology, we're actually caring for over 90 such of these patients on a given day. So we have had to train up quickly.
So what has been what's been the most inspiring thing you've seen running this service?
Yeah, I think there's so many different pieces of the puzzle that are inspiring because this is a really uncertain time. And as physicians, we kind of get comfortable with knowing our own disease, knowing our own specialty, knowing that type of patient. And it is hard to kind of push out of our comfort zone, especially when we don't know exactly what coronavirus is all about, meaning COVID-19 is unfamiliar, the disease that it causes, and it's a bit unpredictable. And so even myself, where I see inpatients normally and stay pretty close to medicine, the reality is the first time I had to cover one of these floors, I was extremely anxious, not knowing what exactly to expect. I got in early at like 5 o'clock in the morning, tried to read everything I could about the patient. I called my ID colleague for everything and really tried to learn that. So I think the most awe-inspiring is seeing people that are obviously concerned. So there's concern for individual safety. There's concern for what happens if I bring this home to my family. And there's also concern of, am I going to be good at this? And despite all of that, seeing the people kind of be courageous, brave, sign up for these different jobs and function together in this teamwork. I mean, these are people that sometimes are oncologists and surgery nurses working together. And it's just been awe-inspiring to see that come together in terms of the team. So there's actually inspiration on a daily basis.
And what's the toughest thing you had to do?
Yeah, I think the tough piece of the puzzle is to figure out how exactly do we do this safely. So for me personally, I'm so worried about each and every colleague because as an inpatient physician director, I'm trying to staff these different units and whether they are regular COVID floors or even a COVID ICU. And I think the toughest thing, or maybe the reason why I'm not sleeping as well, because I'm definitely not sleeping as well, is because I'm just so worried. I take a lot of concern for the people that are in these frontline positions alongside of me. And then also I think that's tough on my own family. So I have a 4-year-old, that's Oliver, and I have a 1-year-old, Sophia, and my wonderful husband, Brian. And when I come home, you should see it's kind of like a well-organized machine, but Brian puts the Lysol wipes on the garage door handle. I grab the Lysol wipe, I go inside, I strip everything down, I put on a robe that's already placed out there and clean. I grab all my clothes, the door is already open, so I run straight to the shower. And as I even enter that first door, little Oliver comes running and he says the same few lines every time. But he's like, Mom, do you have corona? And then, Mom, do you have corona on your hands? Mom. And so then I try to bypass him so he doesn't touch me. I get up to the shower. And so I think there's hard parts at work, but there's also a bit of this kind of uncertainty and challenge at home as well. So I think balancing those two has been probably the biggest issue. But I try to stay as safe as I can. I try to stay laser focused on all of the personal equipment that I need to wear at work to stay safe. But I have made the choice that once I come home and take a shower and do everything that I do play with the kids still, because I worry this is not going to be just a couple days or just a couple weeks, that this may go on for months. And so that is the decision that we make. Obviously it would be different if I had symptoms, but so far that's been okay. But we talk a lot about Corona.
And is Oliver sleeping, or have you noticed a change in Oliver? Or how old? Oliver's 4, you said?
So Oliver's 4, and Oliver sleeps fine because he runs like a maniac. But the reality is, I will tell you what one of the hardest parts at the very beginning, obviously there were many bigger challenges as we come forward, but that first weekend when we realized that the travel ban had went out, and this was clearly something that we needed to think about, social distancing to protect our family, to protect everybody else in the world, but canceling swim lessons nearly killed us. So on Sunday, swim lessons are at 11:30. And just to put it into perspective, we start early that day. We have breakfast, and then we start getting ready an hour beforehand, so that gives us something to do. Then we pack up both kids at 11 o'clock. We get to swim lessons at 11:30. That tires them out to no end. We grab some lunch. We get home. They take a nap. And it is just like a lovely Sunday afternoon. So we really had to dig deep to say we shouldn't go to swim lessons. And that's kind of the daily struggle. I mean, Oliver's been now we did that same thing that weekend with daycare, to where we knew it was really important. He was at the MGH Children's Center, but we knew it was really important to, 1, offer that spot if somebody else needed it, and 2, to play our part in terms of keeping him home. And so it's been a long 51 days. It's 51.
And tell me what's been going on with the cancer patients. So for the folks who are getting admitted still, I mean, cancer keeps on going, right? Despite COVID, what's happening on that front?
Yeah, that's really important as well. So cancer does keep going on, and we're open and ready to accept those patients. In fact, I'm a little worried because the 2 floors that we have for full cancer care are actually not filled. So they are under what we normally see. And so I do worry cancer is continuing on. And I want patients to know that we can safely care for them on these floors. And we are still doing all of the normal pieces of the puzzle that we need to do to take care of them. Now, if it's elective and things that are more outpatient, that may have tampered down, but as terms of inpatient care to get the procedures that we need or to get the medications that we need, all of that is still ongoing. And so we still have our oncology patient providers and specialists.
Is it your impression that people are staying at home too much? Like, are they coming in and you're like, oh my goodness, I can't believe this person's been dealing with this for the last week?
That's exactly my impression. And I worry our outpatient colleagues, because I've been calling them in the clinic to say, hey, are patients still coming to clinic? What's happening? And they say, we really say you need to be admitted to the hospital, but patients are almost hesitant to go into the hospital. And so they said, no, I'd rather go home. And so I do worry, and the patients that are being admitted then happen to be a bit sicker when they do come in. And I just want people to know that we can safely care for them. And in general, as we move forward in the coming months, we're going to have this combination. COVID is here to stay a bit. Granted, we are hoping that the numbers go down and that we don't have a second peak. But I think we're going to have to see a new world where COVID will be in the hospital, and not just our hospital. It will be across the country and across the city. And people are going to have to care jointly for different types of patients. And I just want to reassure you too that we've done this before. I mean, influenza has a certain precaution. We go through this certain thing that we do each year during flu season. And so we will do these similar procedures as we move forward. In fact, now we're actually testing everybody in the hospital to really make sure that we are certain who has COVID and that we can care for them specifically and isolate them from those who do not. So I feel like we're getting improved testing, which will help a lot.
Now, do you think that the structure of our inpatient oncology service is going to change in any significant way moving forward? Either, change because it has to because of COVID, or change because you've learned something about the way inpatient medicine, having to go back to doing regular inpatient medicine or non-cancer inpatient medicine, you're going to bring that change to the service.
Yeah, and I don't suspect it's going to change for the worse by any means. So one of the things that I think has been powerful is really the connectedness, this whole sense of working together, learning together, nurses, physicians, nurse practitioners. It has brought us to a point where we will probably never be the same. So emotionally, the team has never been stronger in terms of the connectedness. And then in all honesty, look at the skill set. So one of our oncology units, for example, our 32-bed unit is now seeing intensive care level patients. And so all of those oncology nurses that we will go back in that floor will be oncology again, but they have this increased ability in terms of the intensive care level. Similarly, doctors have all been trained back up in medicine, and even on the under 10 floors, we have people that are learning how to give life-saving blood pressure support medication. So if anything, we have ramped up significantly in terms of our education and experience, and that togetherness or that connection will keep us through. Now, I do think with the way the actual floors are, there may be a phased approach in terms of how many of those flip back to just cancer patients and how that works over time. But I do think in general, we will continue to, as those floors kind of come back, we will continue to ramp up those normal things that we were doing inpatient.
All right, terrific. So if you had anything to say to patients out there about what it's like, and or if they're concerned. Before I get to that last question, I've heard that there's a no visitor policy. And in fact, I know that there's a no visitor policy. How has that affected the care of inpatients?
Yeah, I think it cannot go understated. So the no visitor policy, I worry about the patients at all times, and I worry about the families that are home. And it has taken a toll on the healthcare providers at the bedside as well, because we feel crushed that the patients cannot connect like they used to and have a caregiver there. So that cannot be understated on everybody's emotional toll that's taking. I will say, though, that the hospital and the community, especially on the cancer floors, everybody is talking to those individual patients, whether it's dietary or nursing or therapy or physicians. We're really trying to connect and be their pseudo family. In addition, we've tried to utilize as much FaceTime and iPads and ways to connect in that manner. And even for the patients that are really critically ill, we were just informed of a new policy where certain providers, in terms of nurses or PCAs, are actually going to potentially stay 15 or 20 minutes longer of their shift and make sure that we support and are with those individual people. So I think although it is not their family, we should know that Mass General is trying to team up to support them through their illness as much as possible and be present.
So the last question, if you had any communication you wanted to get out there to folks, what would that be?
Yeah, I think that it would be, we're all in this together and that everybody is playing their part. I do think it is important for us all to think about social distancing and staying at home and doing our part for the overall community. The other piece I would say is that I think that we are going to have to support each other in a way in the coming months, even potentially over a year, differently. For example, one of the patients that I just discharged, and I was so excited, the patient had just finally come down off the oxygen, was feeling a little better. He was still definitely short of breath, could barely make it to the bathroom, and he was a young guy in his 40s. But when I looked at him after all the discharge stuff and I said, I'm really glad you're getting out of the hospital, he looked at me and I said, is there anything else? What else can I do? And he said, you know what? He's like, I need a job. Like, while I've been here, I actually lost my one and only job. And so when he goes out, I thought, and I was so worried about the COVID. But the reality is that, we're starting to get food at the hospital and a lot of different meals, and we're kind of gaining the freshman 15 all over again from the pizza. But who we need to support are potentially these patients that are COVID, these patients that are, going to go through a very long recovery course, and how do we support them both financially and with the needs that they might have. So I think if we can all band together, that's another thing to think about, are the people on the other side.
Well, thanks for sharing, and you do great work, and I hope we get to our new normal pretty soon.
Couldn't agree with you more, Dave. Thank you for having me.